Hi, Dr. Randy Morris here for Pinnacle Fertility. One of the questions that I get a lot is whether having infertility is linked to a higher risk for other health problems. The answer, unfortunately, is yes. For example, we know that women with infertility have a greater chance for developing ovarian cancer, and that women who don't ovulate have a greater chance for uterine cancer. What about heart disease and other cardiovascular problems? First, let's talk about high blood pressure. We know that people with high blood pressure have a harder time becoming pregnant and have a greater risk for early miscarriage. What about the reverse? Does infertility lead to high blood pressure in the future? For the most part, the answer is no, with one exception. Women who've had infertility due to tubal disease have about a 15% higher risk for developing high blood pressure later in life. No other causes for infertility have been found to increase that risk. What about other cardiovascular diseases? Back in 2011, researchers from Sweden found that when women took longer than 5 years to become pregnant, they were about 20% more likely later in life to be diagnosed with coronary artery disease or stroke. More recently, researchers here in the United States found that women with infertility were about 20% more likely to develop heart failure than women without infertility. There's a really important thing to understand here, however. Although women with infertility were more likely to have heart failure, it still only affected about 10% of all women. So it seems we can now add infertility as another risk factor for cardiovascular disease. So should you do anything different if you have fertility problems? Sure. Try to control as many of those other risk factors as you can, like reducing your weight and quitting smoking. This should reduce your long-term risk for these problems. Thanks for watching. I'm Dr. Randy Morris for Pinnacle Fertility.